Don't look. The audience.
When my little sister Dana was 13, she went to the ear, nose, and throat doctor for just an ear infection to get treated. And the doctor made a comment about her big Italian nose. And ever since then, she always wanted a rhinoplasty done. And she knew people who had it done, so she was looking into it, and the doctor said she would do it at 15 years old. My friends and sister have got it done at a young age, and most of them had complications, so I've seen it firsthand. According to the American Society of Plastic Surgeons, about 219,000 cosmetic plastic surgery procedures were performed on people ages 13 to 19 in 2010. This is important because plastic surgery is becoming an epidemic. It's possible for future generations to have big problems with this, because if kids are getting it done so young now, what's it going to be like in 10 years? Today I'm going to convince you that plastic surgery in teens is not a good idea by explaining the misconceptions of it. Teens often have the misconceptions that it will fix their social problems, it's safe because it's so frequently done, and it comes out exactly how they thought it would. Now let's discuss the misconceptions that plastic surgery will cure all problems socially. Many teens decide to get plastic surgery to fit in as teens, whereas adults to stand out. Teens often feel awkward, like they're not comfortable with the way their body's developing and changing so slow, and they think that they'll be affected in adulthood if it's not corrected. Some doctors will interview teens beforehand to seek maturity over the situation, and they try to prepare you what to expect like before, during, and after the surgery. And they want you to be aware of the initial disfiguration. Like they want to make sure that you know that there's a problem with your nose, not, I think it's ugly, so that's why I want to get a nose job. Like know exactly what you want. My sister was 15 when she had hers done, and to the doctor, that was an appropriate age to get it done. It's important to remember that everyone has insecurities, but not everyone gets plastic surgery. Teens have gullibility and are willing to do extra than intended. So if the doctor says it's okay and their parents are willing to do it, then they'll most likely get it done. My sister, when she got her nose job, the doctor suggested that she should get a lip enhancement, and she got it done, and later found out that the doctor was not certified to do that, and had problems with that too. According to breastimplantinfo.org, a study that ranged from children and teens 11 to 18 years old stated that by the time most everyone with insecurities is 18, it'll be diminished or gone completely. Now let's discuss how misconceptions of curing social problems leads us to the misconception that the plastic surgery is safe because it is so frequently done. Plastic surgery is surgery with risks of complications. For breast implants, leakage and hardening or slippage of the implant is possible. Reaction to medicine or anesthesia, permanent scarring or disfiguration, excess skin removal, nerve, tissue, or muscle damage, and in some cases even death. Many people don't even verify the credentials before they're getting a doctor. They just go from word of mouth referrals, but just because someone had a good nose job or breast augmentation doesn't mean that you will too. But you can call places such as the American Board of Medical Specialties to confirm legitimacy and to make sure that they're board certified. Or you can interview and consult with several surgeons. According to Courtney Hutchison in an ABC article, women are literally dying to be beautiful or end up with complications while trying to get plastic surgery at a cheaper cost by using uncertified doctors, which is really dangerous. A doctor can be one of the best, but everybody has different reactions. Like everybody's body's different. After my sister's surgery, a few weeks later, she had to go to the emergency room because she was hemorrhaging from her nose, and she was admitted in the hospital and had to get another surgery done in her nose. And her friend didn't have that problem, so it just goes to show that everyone's different, everyone reacts differently. The next misconception is that plastic surgery comes out exactly as expected. Teens might have an image in your head of what you think you're going to look like, but it might come out completely different, and then that leads to unhappiness. And unhappiness could lead to more surgeries, and that could lead to an addiction. It could also lead to psychological issues like depression or body dysmorphic disorder, or even low self-esteem. It's unfortunate that teens have to turn to plastic surgery to feel better about themselves at such a young age, but now knowing the common misconceptions that it will fix all social problems, it is safe because it's so frequently done, and it comes out exactly how people imagine. Hopefully with this knowledge, teens will realize that plastic surgery at a young age is not a good idea, and you should deeply consider that your body is still changing, like when you're a teenager, and you should wait until adulthood.